That's called good product placement. McLean County Orthopedic sponsors the weather every day after the 1 o'clock news, and once a month on Thursday after the 1 o'clock news, it's our McLean County Orthopedic segment. And I learn a lot during these segments, and we'll learn something today because Dr. Lucas Armstrong, he says call him Luke. Luke Armstrong is here from McLean County Orthopedics. I'm Mark Strauss. I'm the TV guy on the radio. Thanks for being with us on this chilly Tuesday afternoon. So today on our McLean County Orthopedics segment, we're going to talk with Dr. Luke Armstrong, and he's a gentleman who performs about 200 joint replacement surgeries every year. This is becoming more and more common, and thankfully for people who just have trouble getting around, it's made their lives easier. Luke, welcome to WJBC.
Thank you for having me.
Let's first of all introduce you to people, your background. You were raised here in the Twin Cities, right?
Correct. I lived here all my life with the exception of when I left for training. My parents still live here. Hi, Mom and Dad.
You told me they lived so close to Radio Bloomington, to our facility here, that when they would pick up their landline, they could actually hear one of our
Correct.
Radio stations faintly on the landline.
Back when you had to use them, you could actually hear it through the phone.
Yeah. I don't know if that's good or bad.
And the last time I was actually on this radio station was 1985-86. Someone came to Fairview School when we lived in North Normal and interviewed us for lunch, like school lunch day, and they wanted to know what note my mom had written on my napkin, and I wasn't giving up that information at that time.
Good for you. Good for you. You have a right to privacy. All right. Well, today we're going to talk to you about knee replacements and hip replacements. And before the news, to tease the segment, I mentioned that there are roughly 1 million joint replacement surgeries performed in the United States every year, and that is expected by the year 2030, at least in the Department of Knee Replacements, to grow to 3.5 million. So let's just say, for argument's sake, that doubles for both. That goes from 1 million to 7 million joint replacement surgeries over the course of the next 12 years. It's becoming more and more common.
It is one of the most common surgeries that we do, and it is becoming more and more common due to the baby boomers and aging and doing them in younger and younger patients. We used to say, no, you're too young, you're going to live with this, and we don't really do that much anymore. And also it definitely has to do with the obesity, for knee replacement, the obesity epidemic and how that leads to knee arthritis.
What percentage of people get joint replacement surgery these days?
I would actually say, so you said 1 million today. I don't know the American population, but the majority of people do not require a joint replacement.
What percentage of people don't get it but need it?
Well,
because I imagine there are people that shy away from it because they're probably a little intimidated by the rehab process. That's not easy.
For knee replacement, the rehab process is not a picnic. Hip replacement, a majority of patients, when I see them the next morning, they say that my hip pain is gone. I have surgical pain, but I feel way better than I did yesterday morning when I arrived at the hospital. Like I was telling you earlier, if I could just get away with doing hip replacements, I would do that because I would be the most beloved surgeon in the world. But I do hip and knee replacements. That's what my fellowship training is for. And knee replacements, it takes them a while to appreciate the pain relief. If it takes about 3 months for a knee patient to really say, I'm grateful that I went through this surgery.
So in other words, when they first come out, those first few weeks, are they feeling more pain than they did before they went in?
It's a different type of pain. It's surgical pain. They have better range of motion. They have better function. They have a stable knee, but it definitely is not pleasant. But the greatest, for knee replacements and hip replacements for that matter, one of the greatest strides that we have done in the last half decade is the immediate pain management and postoperative period is way different than a decade ago, and it is much, much better.
We're talking with Dr. Luke Armstrong from McLean County Orthopedics. He performs about 200 joint replacement surgeries every year, and he's been with McLean County Orthopedics now for 4 years, so he's approaching the 1,000 mark. What does it cost to have your knee or hip replaced?
I'll be honest with you, that is something that I purposely do not find out.
You don't want to know?
I don't want to know.
Yeah.
People ask me, and it's
don't
got to
want
be
that-
up there.
You
I don't want to know.
to influence anything that you tell your
I
patient.
don't want to know.
Yeah. According to MayoClinic.org, the average price of a knee surgery replacement, maybe I shouldn't tell you, you don't want to know, according to MayoClinic.org, is roughly $20,000. That's just for one knee.
Yes, that's probably the...
And that doesn't count the rehab, right?
No, that's probably the rehab.
Okay.
So surgery, implant, surgeon's fees, and the majority of that will be the inpatient and postoperative care.
Hey, we're going to take a time out here, so just hang there, and then we're going to come back with more with Dr. Luke Armstrong from McLean County Orthopedics on joint replacement, knee and hip replacement surgery is growing, and by the year 2030, just knee replacements alone in the United States will be 3.5 million procedures every year. Right now it's about 1 million for both knee and hip replacements. That's right now. 118 at WJBC. 28 degrees at WJBC. Mark Strauss with you on this Tuesday afternoon. Joined here this segment by Dr. Luke Armstrong from McLean County Orthopedics. We're talking about knee and joint replacement surgeries. He performs about 200 of those every year. Luke, what is the point where someone who is, having discomfort, either hip pain or knee pain, at what point do you, as someone who's treating that person, you can get injections, cortisone, gel, different kinds of things specifically for your knee. I don't know what you do for the hip. At what point do you sit down with the patient and say, look, it's time to get one of these replacement surgeries now?
So that is an excellent question. And I very, very rarely would tell someone that this needs to be done. The reason being is this is an elective procedure, all right?
Well, what if they come to you and say, do you think I should have this done, or can I continue to get through things with these other therapies?
So I have seen patients in my office, the x-rays have horrible arthritis, and they've come to me, and I said, all right, these x-rays, you have end-stage arthritis. The only thing that's going to help is a knee replacement. And then they tell me, I don't have any pain. Well, that's pretty surprising, but...
What are they there? Why are they there then?
Because their primary care saw the x-rays, and they refer them to me.
How common is that, where they have all these...
Not common.
I mean,
but
it's usually people that are really uncomfortable.
Yes, it's not common, but... You don't operate on the x-rays, you operate on people, and only the patient really knows when it's time. The only time I would say it is probably a good idea to do it is in an elderly female, usually, that their knee arthritis is causing them to fall. The reason being is I do not want them to fall and break their hip, because that's bad news. But the patient will know, meaning they have tried everything, the injections, the pills, the creams, the therapy. They have stopped working. It is interfering with their life, meaning they start piling stuff at the bottom of the stairs and only taking one trip up and down the stairs. They start missing events that they want to do. They see their friends at a ball game and they don't want to climb up the steps to go sit with them, and they take the seat on the front, second or third row. Things like that. And it is an elective procedure. It's a lifestyle decision, and it is a very low risk procedure. It just, when things go bad, there's high consequences.
How often does that happen?
Less than 5%.
Okay, that's not very much.
No, considering there's, like you said,
of course,
the
alternative is if you're somebody, and the people that I know who've had a knee replacement, mm-hmm. I understand the hip replacements. While they're not, a cakewalk.
I don't want any patient that is getting a knee replacement to talk to someone that had a hip replacement and
it's
tell them how easy it is.
Yeah, it's completely different.
And the worst is when someone has a hip replacement and they did great, and then they're like, well, I did great with my hip replacement. I'm ready for this knee replacement. And
explain the difference. Explain what's so different about it.
So what is so different about it is we can recreate the hip joint very accurately with the technology we have today. We cannot recreate the biomechanics of a knee yet. People are working on it as we speak. What we have, the technology we have today, people say, I'm glad I did it. It is a much less painful knee. It's stable, but I can always tell it's not my knee. They usually notice that going down ramps, going down stairs, or uneven ground.
What's the difference in the sensation?
I don't think anyone's figured that out yet. But if you biomechanical studies with native knees and total knees, they do not move the same. We can put in a very good hinge, but the knee doesn't work like a hinge.
If anybody wants to get more information on knee or hip replacement surgery, they can get in touch with McLean County Orthopedics, and you probably have plenty of people there to kind of educate folks who might be on the verge of considering such a procedure, or people who, in many cases, I've got some friends that I know who've had knee replacements. The cartilage wears down to almost nothing, and then they're bone on bone, and they really don't have a better alternative because you're stuck between a rock and a hard place there.
I agree, but I don't want to scare people off because hip replacement is the second most satisfying surgery in the world for patients. Knee replacements is the third. They used to be 1 and 2, but cataracts got so easy to recover from. Now cataracts is the number one for patients. It's still a very good surgery, but you should definitely exhaust conservative measures before you proceed with any surgery.
All right. McLean County Orthopedics, Dr. Luke Armstrong. Good to meet you.
Very nice meeting you.
And
thanks for having me.
Thanks for the discussion on joint replacement.